Psoriasis and psychiatry, does that match up? Well, of course it does, because psoriasis is a complex chronic condition of the skin, but it has multifactorial psychological as well as biological features. Did you know that worldwide approximately 2% of people suffer with this condition? What is interesting though is that recent reports have suggested within the UK that almost 98% of the people suffering with this condition have acknowledged that this condition has in some shape or form affected their emotional health or mental health. And now that's where it gets interesting. Out of that 98%, only 18% of people with this condition have actually gone and sought any help for these mental health or emotional difficulties. Hi all, Dr. Raman Sakhuja, consultant psychiatrist and an honorary professor for psychiatry with the University of South Wales. I'm based in Cardiff and I make videos on mental health topics and give you tips to manage these conditions as best as you can. If you find the contents of these videos helpful, don't forget to like, subscribe, share, comment, and don't forget also to press that bell button icon so that you can get all the notifications for the upcoming videos. Psoriasis. There is a range of mental health and emotional difficulties that can be present. And if you have not already watched it, go and watch the previous video where I've talked about the various psychiatric issues that may be present with chronic dermatological conditions as part of psychodermatological clinical practice that we see in. And then come back to look at this video further. So apart from those range of different conditions with the mental health and emotional difficulties that we talked about in the previous video, some of the most common psychiatric syndromes that we see with psoriasis is anxiety. There can be issues with depression, suicidal ideations, and some form of emotional difficulties leading to social anxiety, or that might lead to avoidance behaviors. So please go and watch that video where I've talked about these things in greater depth. And then comes to the point, how do we manage this? And what has psychiatry got to do with managing this? Now, we've already understood that there's a range of mental health difficulties. So when we start managing the condition, what is very, very crucial is that it has to be a multidisciplinary approach to manage this condition, where the dermatologists can be the most crucial ones to help with the main biological treatments available for the condition to reduce the inflammation associated with it. From a psychiatric point of view, interventions like CBT, mindfulness, and meditation based therapies, or any kind of psychological help or therapies that can reduce the stress levels, can be effective to manage this condition. When there are associated psychiatric syndromes like anxiety, depression, or others, then we sometimes have to use medications to improve that condition. So if any of your friends or family or anyone is suffering with this condition, which is a chronic one and is affecting their emotional or mental health, I would suggest to go and seek appropriate medical help. Go and see a qualified psychiatrist who could be very important in terms of assessing those conditions, looking at the comorbidities along with the psoriasis, and devising a personalized treatment plan to help improve the overall condition and improve your quality of life. If you found this video useful, remember to press the like button, subscribe, share, comment, engage with us, and do not forget to press that bell button icon so that you can get all the notifications for the upcoming videos of this channel. See you up until next time.